According to health officials, cardiovascular diseases, CVDs, are the leading cause of death worldwide. Most cases could be prevented by addressing behavioral and environmental factors such as smoking, unhealthy diet, or physical inactivity. Early detection of risk is crucial so that effective prevention or management can begin as soon as possible. Good and bad cholesterol, one of the major indicators and controllable risk factors for cardiovascular disease, is high blood cholesterol. Cholesterol is a fat-like substance in the blood that is essential for building cells and producing certain vitamins and hormones. However, when cholesterol levels are too high, it can accumulate in the walls of blood vessels, forming deposits known as plaques. If a plaque ruptures, a clot can rapidly form and block the vessel entirely, leading to heart attack or stroke. Cholesterol and other fats are carried through the blood by specialized particles called lipoproteins, which are divided into 4 main classes. 3 of these classes have a special protein on their surface called apolipoprotein B, ApoB. When present in excess, these lipoproteins can deposit cholesterol in the walls of blood vessels. Because of this, the cholesterol they carry is often called bad cholesterol. In contrast, the 4th main class helps remove excess cholesterol from the bloodstream and transports it back to the liver. This is often referred to as good cholesterol because of its beneficial role. Testing for lipoprotein carriers rather than cholesterol. Itself, when assessing the near-term risk of heart disease, a doctor needs to determine whether the levels of bad cholesterol particles are high enough to be harmful. Currently, this is done by measuring cholesterol levels in a blood sample. However, since cholesterol cannot circulate or cause damage without its lipoprotein carrier, researchers have increasingly focused on measuring the lipoproteins that carry bad cholesterol as a likely better indicator of future cardiovascular disease risk. It was previously unclear if 2 patients with the same total level of bad cholesterol, but differing in their carrier characteristics, lipoprotein type, size, lipid content, have the same risk of heart disease. The aim of recent research was to determine the importance of these different parameters. Number of lipoprotein carriers matters. Most researchers analyzed blood samples from over 200,000 people in the UK who had no history of heart disease, measuring the number and size of different cholesterol-carrying lipoproteins in the blood. The focus was specifically on lipoproteins that carry ApoB, which is found on all bad cholesterol carriers. By following participants for up to 15 years, the study examined which patterns of lipoprotein types and sizes were most strongly linked to future heart attacks. Key findings were validated in a separate study. This combination of advanced blood profiling, large-scale prospective data, and independent replication allowed for the most comprehensive assessment of how bad cholesterol lipoproteins contribute to the development of heart disease. The results showed that ApoB is the best marker when testing for risk of heart disease. Since ApoB indicates the total number of bad cholesterol particles, measuring it offers a more accurate test than standard cholesterol measures. While conventional tests generally perform well, in about 1 in 12 patients, standard cholesterol tests may underestimate heart disease risk. This is important to consider, since 20–40% of all first-time occurrences of CVD are fatal. By switching to ApoB testing, accuracy can be improved and potentially more lives can be saved. Another key marker. The study concluded that the total number of bad cholesterol lipoproteins is the most important factor to consider when testing for future risk of heart disease. Other factors such as size or type of lipoprotein did not affect the potential risk overall. However, the research also showed that another bad cholesterol lipoprotein called lipoprotein A is an important part of the puzzle and should also be tested for. Its levels are genetically inherited in most individuals and represent less than 1% of all bad cholesterol lipoproteins on average in the general population. However, in some individuals, these values are extremely high, significantly raising heart disease risk. The results indicate that ApoB particle count could eventually replace the standard blood cholesterol test in research and healthcare worldwide, and that lipoprotein A also needs to be tested for to get a better picture of lipid-related CVD risk. Blood tests for these 2 markers are commercially available now and would be cheap and easy enough to implement.